Hi, my name is Leslie, and for today's skill video, we're going to be doing an assessment or immediate care of a newborn. So before we grab the newborn from the doctor once the baby's delivered, it's really important. We always want to make sure we're positioning the baby and making sure we're holding them correctly. So once we get the baby, the first thing we want to do is make sure that we are grabbing them and wrapping them around in a blanket, turning them on their side so that way we can get this drainage out. So we're going to take a bulb and we're going to remove the drainage from their mouth and their nostrils. So we're going to remove 1, 2. All right. And then we want to go ahead and dry this baby off really well. So we're going to take towels, making sure that we're cleaning them off. You know, they have all that fluid and stuff from being in mom. So we're going to get them dried off, get them really cleaned. When we lay the baby down, we always want to make sure we're laying them on the side, so in case they do have drainage, that can continue to come out. So again, we're going to dry the baby off really good. And then the next thing we want to do is stimulate the baby. So we want to make sure that the baby is crying. So, putting rubbing on their chest a little bit, rubbing them around. We want to make sure that their lungs are working really well, that they're crying. If they're not crying, that does show some concern. So we again want to stimulate the baby, making sure that they are crying. We always want to make sure we're putting the baby on dry and clean linens. We want to put a diaper on the baby. And then we want to go ahead and keep them warm. So we want to make sure we're having plenty of blankets. We can wrap them around using the kangaroo method in the blanket. At the hospital you work at, or facility, they should have lamp warmers. So these will come in and they will put heat over top of the baby to keep them nice and warm. We also want to make sure we're using head caps. So again, a lot of hospitals will come with those, either for the boy or the girl. They'll have unisex ones. I don't have one at this time, so we are going to pretend that the baby does have one on, but making sure that we're keeping their head warm, their body warm, and all of that. So like I said, we're going to make sure we're drying them off, stimulating, making sure they're on the left side to flow that drainage out, and making sure that they are nice and clean. So once we get them laid down and all of that, we're going to go ahead and do an APGAR. So with the APGAR, that tests the respiratory rate, or we're going to look at the respiratory rate, the color of the baby. We're going to look at the muscle tone. We're going to look at the reflexes and the apical heart rate. So with the APGAR, we want to do that in the first 5 minutes. We also want to do one after 5 minutes. So we're going to go ahead and unwrap this baby. I'm just going to position this blanket a little bit better. There we go. So again, we're going to listen to the apical heart rate first, and we want to listen to that for 1 minute. Okay, and again, like I said, you do that for 1 full minute. If that looks okay, we're going to go on to the respiratory rate. So we want to make sure they're not breathing too little. We also want to make sure they're not breathing too much. That will probably involve NICU to come in and take a look at that baby, and that baby might need some further assistance. We then want to look at their color. So when they first come out of the womb, they're going to be a little bit blue, but by the time we're doing all these things with the baby, the color of the skin should pinken up a little bit. It is normal for their feet and their hands to be a little bit more on the bluer side. That is normal. We would always want to pass it along to the doctor, let them know, but again, that is normal. But for the most part, we're looking to make sure that the rest of their body part is pink. We then want to make sure, after we check all that, so the color, the apical heart rate, respiratory, and the muscle tone, we want to check the reflexes. So a good one we like to do is the tapping on the bottom of the foot, and that makes sure that their body is going inward, so that means the reflexes is working well. So next thing we want to do after we do the APGAR is we want to look at their umbilical cord. Big thing with their umbilical cord is we want to make sure that A, it's not bleeding, and B, that there's 2 arteries and 1 vein. It's very important. In the hospital, they'll give you a little clip and it'll clamp that umbilical cord. There is umbilical cord care. A lot of times it's just putting some Neosporin on there. But when they go back to mother baby, they will explain all that to the mom and make sure that the care is proper, when it will fall off, things like that. After the APGAR, we want to do vital signs. So we want to look at their oxygen, we want to look at their heart rate, we want to look at their respiratory, we want to look at their blood pressure. So with doing a newborn, it's always important we use a correct blood pressure cuff. If not, it can obviously give us a wrong reading. So it's very important that we use a newborn blood pressure cuff when doing a blood pressure on these babies. And when we get that, we then want to check their temperature. We're going to do that auxiliary. I don't have one on me, so I'm going to pretend my finger is the thermometer. And how we do that is we want to take our thermometer, we want to put that under the baby's armpit, put the arm very close to the baby, and then that'll give us an accurate reading on the blood, on their temperature. And we will have to hold it there for a few seconds until it beeps, and then we'll know the temperature. So then we want to go into a very good, thorough head-to-toe assessment with the baby. We always want to start at the front of the head. So when we're doing that, there's a few things we need to look at the head. We want to look at the posterior and anterior and posterior of the head, and we do that with sitting them up. So we're going to sit them up. It's very important that when we're looking at that, we don't want their head sinking in. If we do, we immediately need to let someone know, and we need to call NICU. We also want to look for, I'm sorry if I say these names wrong, but capsucceodium, which is edema on the scalp. And then we also want to look for cephalohematoma, which is a hematoma on their head. When looking at those, we want to make sure we inform a provider. These typically will resolve on their own. Both have different dates of when they will resolve, but we let a provider know. That way the provider can go and explain that to mom, how long it will resolve and anything that she needs to do for the baby. So then we're going to go out, make sure we're looking at their eyes, putting our finger in our mouth, making sure they have good suction, looking at their neck. We will look at their chest, making sure they're breathing okay. We want to look at their arms, again, for legs, muscle tone, looking at that umbilical cord, their belly. We want to put a finger on their hand, make sure they're able to grab that. And then again, we can also tap again the foot, making sure they're reflexing really well. When we are doing an assessment, we want to make sure that the baby has 3 good reflexes. So like I said, you could do the ways that I explained, or you can, trying to think of a few other ways. You can move the baby's hands up, pull, and make sure they kind of pull them back. You can kind of lift the baby up a little bit. There's a couple different ways, but we always want to make sure we want to do 3 reflexes, that they are able to do 3. And then once we get done doing a good head to toe on the baby, we want to make sure we measure them and weigh them. So whenever we do that, we want to take a tape measure, start at the bottom of their foot, work all the way to their head. You also want to measure their chest, and you want to measure their head, going a little bit above the eyebrow, going all the way around the head to get those accurate readings, making sure we are writing them down. And then we want to weigh the baby. So we're going to go ahead and wrap this baby up. So when we weigh the baby, the biggest thing we want to do is we want to make sure that there's nothing on the scale. We want to weigh the scale out, and then we want to gently lay down the baby. And we're again trying to making sure we're keeping them on that side in case of drainage. When we do, biggest safety is that we want to keep our hand close around the baby so that they don't wiggle or roll off of the scale. So we want to stand by, keeping our hand close by the baby. Make sure the baby tries to keep their hands as close as possible inside of the scale. Once we get that, we want to also record that. We want to give the measurements to a provider, making sure they're passing that along to mom, because a lot of times moms like to know how much their baby weighs and all of that. So once we get done with measuring and weighing the baby, we're going to go ahead and move on to a couple more steps. we're going to give them prophylaxis ointment in their conjunctival sac, in their eyes. So how we do that is we're going to take 2 cotton balls. We're going to moisten them up a little bit. And we're going to take each one and clean in one eye. So here's 1, 2. And then we're going to take that ointment and again putting it in their conjunctival sac. Here we go. And then the next one is we want to give them a vitamin K shot. So when we do a vitamin K shot, we're going to do that in the Vectoris lariatus, which is the side of their leg. So we're going to unwrap and see where's the side of their leg. We're going to go ahead and clean that with an alcohol swab. Get our needle, inject, top the needle, and then we would apply a bandage. And then the next biggest step is we want to make sure that both mom and baby have bracelets. So they do this for safety for the baby. That way no one can take off with the baby other than mom, unless someone else is granted, maybe per father. But a lot of the times they don't want no one to have one other than the baby or mom. A lot of hospitals and facilities do have extra precautions as far as having a lockdown unit. The alarms or stuff will go off if someone does try to take off with the baby without them having a wristband. It really just depends on facility, but majority facilities do have mother-baby bracelets. It's very, very important that these are put on mom and explained, why we are putting these on and the safety of the newborn. So after we do an assessment, we apply these bracelets, we give the vitamin K and give the ointment in their eyes. The baby should be good to go to mom. So again, very important that we are keeping the baby warm. Very important we're doing that APGAR, first one within 1 minute, second one within 5 minutes. We're checking that umbilical cord. And giving them all the proper things that they need. So once they're done, we're going to allow them to go back to mom if they're able to, do skin to skin and have some bonding time. And then when they're ready, then we'll move them to a mother-baby unit.